Hi, Dr. Nielsen. I just want to welcome you here to our webinar that we're doing this series on what it's like to work in different areas of nursing. So we've got Dr. Nielsen here from Illinois State University, and she's going to be talking a little bit about what it's like to be a nursing professor. Would you like to introduce yourself, Dr. Nielsen?
Sure. Um, Thank you for your introduction, Brandon. My name is Sandy Nielsen. I am a nursing instructor, have been for the last 8 years full time. And I worked in some year for a half a semester doing a sim lab prior to, and it was a lot of fun. But um, prior to that, I have been a nurse for, over 30 years. I don't want to tell my age, but I have a lot of experience in acute adult ICU, ambulatory, parish nursing, and now I am a clinical faculty and director of the undergraduate program at Mennonite College of Nursing, one of the premier nursing institutions in the state of Illinois. So I'm really proud of what I do.
Yeah, I'm actually alum, so. So out of those areas that you worked before you became a nursing professor, which one do you think would be like your favorite one?
That is a hard question, but I would have to say when I worked as a nursing supervisor in a pretty small hospital, not quite critical access. We had 56 beds. I liked the idea of being able to go to one department and help out there, and then help in another department, and I have really started to enjoy administration and working with other people and trying to get the best out of that person that I could get. And I do some of the same things in this job right now. I like I liked that quite a bit. I mostly worked nights for that job. It was a beautiful job. Loved it. Loved it. Loved it. But that is also something that there's a season for. And this season is the season for teaching.
So what made you decide to become a nurse in the first place?
Terrible, but I love people. I love science. I love biology, and I had my high school sweetheart, and I wanted to get married, and I said, well, let's see if we can get a job that is worth doing in a short period of time so we can facilitate getting married. And I looked at the jobs that were available at the time, and I said, okay, I think I can be a nurse. And I graduated with an associate's degree in nursing back in 1989. And we got married instead of going to graduation. And it was a fabulous job. I fell in love with it as much as I fell in love with my husband. And now we have been married, now I'll say 34 years. So I don't regret anything.
Yeah. So what kind of led you down that path to becoming a professor?
I am a firm believer in going back to school every 5 to 10 to 15 years. So I went back to school 5 years after becoming a nurse because I wanted to get a bachelor's degree. And I started paying attention to what the faculty were doing with their life. And they suggested, hey, do you want to become a nurse practitioner? And at the time, I really did want to, but my family situation would not, it wasn't conducive to my life. So it was always something I thought in the back of my mind. I want to go back and get a master's degree. Do I want to be a DNP or a PhD? Do I want to just be an FNP? I really didn't know. And I really didn't have the opportunity to do so at that time. So then I took different jobs, and I found myself teaching in a large hospital organization as a leader in the organization. I really like teaching, really like it. There's something about seeing the light bulb go on. They understand. They didn't understand, and now they understand That is a beautiful thing. And so I fell in love with teaching as well. So I married my two loves, teaching and nursing. And I said, well, I think I know what I need to do now. I need to be a PhD nursing instructor. I want to do some research. I started getting involved in that. And so that made a lot of sense to me to go ahead and get my master's in nursing education and then seek out a terminal degree. And you can teach with a master's in nursing education anywhere. Now I have a PhD in nursing, and yeah, I can do a number of different things. So I have a lot of flexibility in what I choose to do, and I choose to do this right now. I suspect I will choose to do this for the rest of my career.
Now, could you talk a little bit about, because I know it, it might be a question that's out there about tenure and what that means and how, it's different from university to university, like
Mhm.
requirements wise, but what is entailed in that in a general sense?
Generally, universities require someone to publish in order to have tenure. I have several publications right now. I'm working on more than I have even published currently. Um, Tenure generally is associated with that. I suspect that at some point in the near future, nurses with DNPs who have been disadvantaged because they don't have the research that a PhD has in their general education. I'm not speaking of their experience. I believe that DNPs have a lot of research experience in informal ways,
Mhm.
but they don't tend to get as published, or sometimes they aren't published when a PhD nurse is published. But there are so few PhD nurses and so many more DNPs and FNPs and master's degree nurses, and all of them can publish, including maybe even a bachelor's degree nurse. But tenure requires a terminal degree and publications. I hope that at some point universities will understand that the experiences that you come in with, nursing is, it needs to be, nursing is so different. The experiences of being a nurse need to be considered in the tenure process, and currently they are not.
Mhm. Yeah, so do you think you see like an evolution in the future where DNPs that come in with like a certain amount of experience may get considered for tenure then?
We do have some DNPs who are considered for tenure, but they have done it in the same way that the PhDs do. They have to publish. I suspect, as you suggested, that there will be an evolution of tenure in even state universities. I know that smaller universities are, they have a wider variety of what tenure means. But to be honest, tenure isn't what it used to be. Um, the guarantees of having a job every semester exist for people with a master's degree. If they want to teach every semester and they're full time, we hire them over and over and over again, and they have all summer off. Well, officially, unofficially, they're still working on their courses. And let's be honest, they probably did a lot of work during the summer in order to be ready for fall. But the tenure faculty are working all summer on getting published, and that would be true of the DNPs as well. So I think that there will be an evolution, um, where that will be. I feel like the nursing experience is so important,
Mhm.
and I think that will be acknowledged.
I just want because I'm a DNP. So
Yeah, there you go. So what do you think? I mean, Brandon, I'll throw the question around to you as we're talking. What do you think?
well, I know that I don't know the ins and outs like real in depth in the university level. Like I teach also at like a community college. But I do have like one published, paper out there. But that was part of my doing my doctorate is like, okay, here I've got to do all this like work on a particular project and then publish it. And we do a lot of research in order to figure out like, and it's all meta research. Like,
Mhm.
what do we have to review and determine what is the best course in order to get the result that we want, or think we should get, is basically what you're doing. Is you've got this theory that, like, okay, I've went through all this research and I've found all these things. This is what we should implement, and this is what should work as evidence-based practice. Now let's put it into practice. Let's see if it works. And then we publish whether or not it works. So in a way, it is research, but it's taking somebody else's research and then determining whether or not it actually worked for us. And maybe they did it in a different way than we did it. And it just, the details aren't there for us to see often about how they went about that research. That, and like, I haven't published anything else like for nursing. I've had other things published, but thinking about it, and then I think because of the meta research that you do within like a DNP, it kind of sets you up, especially somebody like myself who kind of thinks this way, in like theoretical terms, and being able to do a theoretical piece of research and be like, okay, I've looked at all this stuff, but there's this piece that's missing there that I
Mhm.
think if we tweak it this particular way, I can create the theory that eventually will have the research to back it up.
Beautiful. I mean, that's exactly what we're missing in research by itself. I mean, the hands-on research that can go to the bedside or to the ambulatory setting that can inform the healthcare community how to do something with best practice is really pinnacle. So I think DNPs and PhDs should work together. And we need to also work with other groups, social work. I was just thinking about some intercollaborative practices with our criminal justice people here at the university. I have access to these people who do de-escalation training. What would that look like if I had de-escalation training with my nursing students? How much more prepared would they be in order to facilitate de-escalating a client? And what would that look like? What's the evidence-based practice on that? What research could I do on that that might be qualitative or quantitative research? There are so many opportunities right now. It it's amazing.
Yeah. Yeah. I mean, there's
I'm glad to hear you say that, Brandon.
I like I was in mental health, like, and I was a leader there, and I taught like the de-escalation stuff. So I know what you're like talking about with like teaching it and having we did more of it in the behavioral health setting because we would do
Mhm.
reviews every month, like on certain things. Like, let's just take one topic out of the de-escalation process and just like hit on that topic for that month, and then we would move on to a different one, and just to keep it refreshed and in everybody's mind who's doing it more often. The but you're seeing it so much more across all of healthcare now. Like, it is.
Absolutely.
I like I when I was working in leadership, it was not often. It was less often on the behavioral health unit. It was mostly in the ED when you have somebody who comes in who's very acutely manic and psychotic, that you have these de-escalation needs. And then, like, that, I think that is the more important like thing about it, is like, and then you have not only patients but family members that escalate, and how to handle that, like, on a minute
All the
you.
time.
Yeah. Yeah. So that is huge right now. It's such a big topic. I was just sitting on the IHI's roundtable on that particular topic, which was an interesting discussion because they had all different people from different like areas, but like it's definitely a hot topic like right now. Um, but you hear a lot about it. You hear about the violence that's happening within healthcare right now. And
It,
it's rough.
it is rough, and we're sending our nursing students out, and if we don't send them out prepared,
Mhm.
then we're doing them a disservice. which
Yeah.
is why I teach. I want them to be prepared to walk onto the floor and do what they need to do.
Yeah. Yeah. I stress that with because I do the behavioral health clinical. And I tell them, like, I know a lot of you are not going to go into behavioral health. I'm not here to try to convince you to go into behavioral health. I'm here to help you understand how to talk to patients, figure out how to de-escalate, like if you need to, or step away from the situation if it becomes uncomfortable or you're not able to handle it, and understanding how to ask for help and understanding how you can develop your care plans and interview a patient and talk with them therapeutically because you're going to need it not only in a behavioral health setting, you're going to need it on med surge, ICU, ED, OR, no matter where you're working.
Everywhere, everywhere. And it's really part of caring for your client. If you want the best outcome, you must have an appropriate communication.
Yeah. Yeah.
So I love that. And I think that there's a lot of room for us in education to be a partner with even staff nurses. Our school has a graduate program for nurses who are school nurses, and they get a certification. Um, that wouldn't exist without an environment like a university who can have the faculty who are trained to teach and have the content knowledge.
Mhm.
So we need to partner with our school nurses across the state, and you know, we have over 100 school nurses almost every year
Mhm.
attending our little mini seminars, and they are not undergraduate nursing students who, you know, are just knocking on the door. Hello, my name is, can I take your blood pressure, for the first, you know, 100 times. um, so there's a lot that you can do as a nurse faculty, and that is really what you wanted to know is, what do you do as a nurse faculty member? What does it feel like? What does it look like? You're still a nurse.
Mhm.
You know, you're just a nurse training other nurses
Yeah.
in wherever, whatever they want to do. You know, you're going to facilitate their success.
Mhm. So what would you say is your favorite part about being a professor?
Well, like I said, that light bulb or aha moment is really, I used to be an ICU nurse. And so some of us are a little bit adrenaline junkies. Some of us. Now, some of us are a little tired now. You know, your fight or flight response has gone way over and you're now into exhaustion. But I do like the theoretical portions of how to teach and why people learn. Think about, you know, is this behavioralism or cognitivism? Is this student's learning is auditory, or this student has to do hands-on? Um, I'd like figuring out the puzzle for each individual student.
Mhm.
That's a lot of fun. It's a lot of fun when you can incorporate multiple things into a classroom time. And really, it's not lecture. It's a back and forth.
Yeah. And what would you say is the most difficult part of your role?
Well, in my current role, the most difficult part is I'm the director of the undergraduate program. So I get I can get somewhat discouraged because if a student is not performing well, they all end up in my office. And there are always reasons, and they vary depending on who the person is. And sometimes I feel like the student would be a very good nurse, but there's this whatever problem, and they can either solve the problem or they can't solve the problem, and I can't solve it for them. That hopelessness of not being able to help the student um, is discouraging sometimes. But I will say, I do feel very successful in sometimes when you have critical conversations, crucial conversations, really, with students. They realize what they need to do, or maybe that they might not want to be a nurse, they might want to be something else, and they've only thought of nursing. And if I can steer them into something that will make them successful in life, then I'm successful.
Yeah.
Yeah, it's
That's
hard.
Yeah, that
you
is
know?
that's very, like, a difficult conversation to have with somebody is whether or not it's the right place for them, to be a nurse.
Right. Right.
Um, but there's so many other places within healthcare that you can still have an impact on patients where
Absolutely.
you may not be a nurse, but you may be a respiratory therapist, or like, and you
Physical therapy, respiratory therapy,
yeah,
psychology, maybe a police officer, and honestly, police officers are part of the healthcare team these days,
yeah,
most truly. Maybe they want to be a teacher. Maybe they need to take a few years off and figure out what they want to do.
yeah,
Those are really hard conversations, but worth having.
yeah, yeah. You gotta figure out whether you're doing it for the right reasons and
Yeah.
moving forward and completing your degree
I
or
mean, I
not.
hate to say it, but some nursing students come in and they think, well, I'm going to work nights, I'm going to work overtime, and I'm going to make, X dollars. And that'll last about 6 months.
Mhm.
And if you don't want to care for people, you're not going to be a nurse eventually. I mean, you're just not, because it's all about caring. Those basic, going back to Florence Nightingale. I mean, why did she do the research she did? Because she wanted people to survive the Crimean War.
Yeah,
And that was the beginning of what really nursing is, caring for people with evidence-based practice and the reasons that we do what we do. And it's all boils down to really just caring.
yeah, yeah, it definitely does. Um, it's been a pleasure talking with you, Dr. Nielsen.
Yeah.
I I don't have any questions,
Okay.
other questions for you, but it was definitely a pleasure, like, learning more about, this side of nursing and professorship and even in the administration, of, a university. Um, so I
Yeah.
just thank you so much for doing this.
Well, it was my pleasure and honor. And thank you, Brandon, for bringing this up. And I wish you the best of success in your dual roles. I wonder how many hats you have.
A
Yeah,
lot.
I still teach, even as an administrator, I teach this and that and the other, and it's so rewarding. So I hope that some of your listeners or watchers will consider nursing education.
Yeah, it's definitely a need for it.
Absolutely.
Yeah.
Well, thank you, Brandon.
Thank you.